Tell us a little bit about who you are from child to becoming a plastic surgeon.
Oh, that's a very broad question. Let me start by saying I'm Chris Pannucci, and I am a board-certified plastic surgeon here at Plastic Surgery Northwest in Spokane. I have had the distinct opportunity and wonderful opportunity to be here for the past 7 years. I have been in practice as a practicing plastic surgeon after training, and we'll probably talk about it at some point, for the past 13 years. I did the first 6 years of my career as an assistant and associate professor with tenure at the University of Utah, and have been here in Spokane at Plastic Surgery Northwest as an owner and partner for the past 7 years.
What in your life inspired you to become a plastic surgeon?
It's a big question. I suppose we should start from the beginning. I know that if you watch a Marvel movie, right, they always have like an origin story. And I don't necessarily have like that distinct aha moment. But I do remember actually what I wrote about in my application for medical school about a formative experience. Probably one of my first memorable experiences with medicine was actually my sister, who had a bone infection. She had osteomyelitis when she was a kid. And I do have this very distinct memory of her actually wheeling an IV pole around our house in New Jersey with she had these little bears that clasped onto it that people would buy her. And she had her own IV fluids and IV antibiotics dripping in. It was our pediatrician, Dr. Fermaglish, and actually his partner, Dr. Dicker, who made that diagnosis. And I actually remember, I don't even know that I ever met Dr. Dicker, but I always imagined him as like some gray-haired guy with glasses and a white coat pouring potions in the lab and making that aha diagnosis that ultimately saved my sister, who's fine. And, you know, I go back to that story a lot because it's probably the first memory that I have of medicine and how it related to me. And it's definitely something that has stuck with me for a lot of years. Flash forward from that, right? High school, college. In college, I had some really wonderful mentors, and I was very fortunate to have them. And as a guy whose schedule is pretty full now, I look back at the time that some of these people made for me, especially John Simpson, who was the medical student advisor at Indiana University where I did undergrad. I remember the number of times that I just showed up at his office with a question or to chat or for whatever. He always greeted me with a smile. He always made time for me. And then on the back end, when I was applying to med school, he was the guy that would call and say, listen, this guy's been in my office. He's been knocking on my door. He's been diligent. He's been thoughtful. He's done well in school. He's the kind of guy that you want to have as a medical student. Those types of people, I guess I've been very fortunate to find or to seek out during various stages of my training. And, you know, it is a really wonderful opportunity to say thank you to those people because I would not be here if not for them. The other one, I suppose, that when I was an undergrad was Carl Kraft. Carl was a vaccine scientist at Abbott Laboratories, and his daughter was actually one of my older sister's college roommates. Carl Kraft worked at Abbott Labs, and they had one of the top science internships in the country. And I applied for that science internship with exactly 2 summers of lifeguarding on my resume. And I got the internship. Granted, I probably wrote some very compelling personal statements and something that made people say, wow, this guy is great. But I really think that it was that Carl Kraft really showed up and advocated for me and said, hey, I know this kid personally. He may only have 2 summers of lifeguarding on his CV and 1 summer of college or 1 semester of college, but he really is somebody who's going to do well. And I tried to own that. I was at Abbott Labs for 3 summers. I worked my backside off, did some really interesting research. It was one of my first forays into the research environment and was able to springboard that into not only having a lot on my CV when I applied to medical school, but frankly also having some interesting and relevant things in medicine to talk about. So a lot of wonderful influences for me, you know, even before I was in my 20s and going to med school, of how I ended up being a doctor.
Yeah, that's awesome. Tell me, did you have once you were in college, did you have this like aha moment that says, I'm going to be a plastic surgeon of all the practices of medicine that you could do?
Absolutely not. And in fact, I was voted my first year in med school, my classmates to a person voted me most likely to be a nephrologist, a kidney doctor. On different days, I'd be wearing a bow tie, and maybe if I had a tweed coat and some leather patches, that might even sit better. But I was not on the plastic surgery trajectory, even probably until third year of medical school. For me, one of my friends, Brandon Rock, who's now a pediatric neurosurgeon, had done the plastic surgery elective as a third-year med student the month before me. And he said, hey, you really get to do a lot. You really get to sew and learn. And I said, well, I don't know what I'm doing, but it's probably going to involve sewing. So what a great opportunity. And again, we talk about mentors, and I think of Susan McKinnon, who was the division chief at WashU in St. Louis, where I went to med school, Tommy Tung, Terry McCatton in particular. You know, those three really took an interest in me, really engaged with me, really made time in their day-to-day, and never seemed bothered if I had a question or sent an email or popped into their office or asked a question in the operating room. And again, you think of mentorship, right? Like, if I had had a bad experience with the Washington University and St. Louis plastic surgeons, I might not be sitting in this chair. I might be an ENT surgeon or an orthopedic. But as it is, I'm probably here because of their interest in me, because of their willingness to take time out of their busy day to encourage, to cultivate, to support me. And those are the folks that ended up writing letters for me to get a residency spot at University of Michigan, making phone calls that probably got me a little bit higher on that list. This is not a seat that I could have achieved by myself. I am only sitting here. Certainly I worked hard, but because others recognize that hard work and were willing to advocate and empower me to get up to that next level. So thank you to all of them.
We're here now at Plastic Surgery Northwest. This is your practice. Tell us kind of what you specialize in and what your day-to-day life looks like here at work.
I am very fortunate to co-own Plastic Surgery Northwest with my 4 partners. There are 5 of us. For me, my practice centers on breast and body. That is both breast and body aesthetic, things like breast augmentation, breast lift, breast reduction, body aesthetic, things like tummy tuck in particular, and then breast reconstruction, be it with implants or tissue, the DIUP flap, or other means of breast reconstruction. A smaller part of my practice is general problem solving, and we'll probably talk about the problem solving nature of plastic surgery at some point. But people call us when they aren't really sure, when they're not entirely convinced about what the right direction to go is. And sometimes that's wound healing problems, sometimes it's exposed structures like bone or muscle or devices. And, you know, we are the collective, we are very fortunate to be the recognized problem solvers in surgery, to the point where some people's algorithm says, if I don't know what to do, then I will call plastics. And I suppose I'll dovetail into a story, right? So when I was actually my friend Amit Mathur, who was one of my co-residents at the University of Michigan, he was the transplant surgery fellow at the University of Michigan. In the middle of the night, they're putting a liver in, and it's a big liver and it's a small person. And every time they try to close the abdomen, the liver folds over and kinks off its own blood supply, which is not consistent with the liver surviving, which means the person is not going to survive. So they fiddle with this for hours and they can't figure out a solution. And so they say, what should we do? And Amit pipes up, says, why don't we call plastics? So they called Paul Soderna, who was the chief of plastic surgery at the University of Michigan at the time, and they explained the situation. And he said, why don't you put a breast implant in there? And you can just sort of imagine the transplant surgeons at 3 a.m, their minds exploding with, what on earth are you talking about? But Soderna talked them through actually wedging a breast implant under the liver, which kept it from folding over on itself and kinking off its own blood supply, and allowed the liver to survive and by extension that patient to survive. Bill Kuzan, who was the division chief of plastics at Michigan before Paul Soderna, has this great Venn diagram where plastic surgery is the center of the surgical universe. We are the folks that innovate and problem solve and then disperse that knowledge out to the greater surgical community. And there's so many examples of that. The first kidney transplant in the world was actually done by a plastic surgeon. Joseph Murray in Boston transplanted kidneys between identical twin brothers using techniques in vascular surgery, plastic surgery, innovation, et cetera. One of just a myriad of ideas that plastic surgery has created that have been more widely adopted by the greater surgical community.
Yeah, you definitely make a huge impact. Can you tell me of a time where you, or maybe a particular patient, where you just felt like you made a huge impact on their life? It was inspiring, or it just changed their life in a really big way. I'm sure there's a lot of those stories.
There are a lot of those stories, and I probably won't focus on any one in particular, honestly, because there are just so many. But I have the unique privilege of meeting folks at really challenging times in their lives. Sometimes I meet with someone who says, pregnancy has ravaged my body. Pregnancy has changed the person that I see in the mirror, and I don't recognize them anymore. Sometimes people say, I used to be 340 pounds. And I have taken on this weight loss journey, this life-changing weight loss journey. And now I have all of this loose skin and an aesthetic I'm not pleased with. Sometimes people don't choose to meet me. People get breast cancer. People get bitten by dogs. People have other terrible problems, car accidents, etc. And I get the opportunity to meet with people at maybe some of the highest points of their lives, right? I'm healthy. I've lost 100 pounds. Sometimes at the lowest points in their lives, right? I was literally hit by a truck. I was diagnosed with breast cancer. And again, I get to meet with people, and sometimes it's not at their best. But what's really amazing is to take them through that process, and whatever the process is, and to shake hands with them at the end of it, to see them walk out of here and feel like the person that they should be. That is just a uniquely gratifying experience to be able to participate in that journey with so many people on a regular basis.
You kind of spoke to this in what you just told me, but what does it mean to you to be a surgeon, to be successful at what you do, to have a heart for plastic surgery? What does that mean to you?
It is a privilege, and it barely feels like work most days. Like, I so love being here. I so love being in the operating room. I so love meeting patients and seeing them through this journey and helping them to walk out these doors looking like the person on the outside, like the person that they feel on the inside. It is just so uniquely gratifying and wonderful. And, for me, it is a labor, but it is absolutely a labor of love. And I feel just so fortunate to be able to do what I do on a daily basis.
So plastic surgery is a very broad field or industry. So can you break down for us what that entails? All the processes and the procedures that happen within plastic surgery.
You're entirely correct that plastic surgery is gigantic, and it involves aesthetic surgery, breast reconstructive surgery, hand surgery, pediatric craniofacial surgery, trauma reconstruction, a myriad of things. For me, I certainly trained in all those things, and I have done all of those operations. But over time, I have, with intention, scaled my practice down to the places where I see myself making the biggest impact, to the place, frankly, where I see myself using my skill set in a way to positively impact lives. For me, that comes down to doing two things. One is cosmetic surgery, especially the breast and body for me, and two is breast reconstruction. And maybe we can talk about each of those directly. So from the cosmetic surgery perspective, cosmetic surgery is so interesting. It is something that people can choose to do. For a long time, it was not necessarily mainstream. It was something that happened behind closed doors, something that wasn't talked about, something that, people would go somewhere and have surgery and heal for 3 months and not talk about. And I think one goal for me certainly is to normalize the conversation around cosmetic and aesthetic surgery, to make it something that can be openly discussed, something that can be ideas kicked around and people say, I'm considering having this, because it shouldn't be a black box. It should be out there. Why is it any different than any other type of surgery just because you can choose to have it? For me, my aesthetics practice continues to grow, and I focus in two areas: breast aesthetics and body aesthetics. We'll probably talk in a minute about my experience in breast reconstruction, and in my opinion, the two of those really dovetail very well, because breast reconstruction is aesthetic surgery of the breast, but also often aesthetic surgery of the body if we're using abdominal tissue to reconstruct the breast. And so I spend most of my day-to-day in those areas. From the aesthetic surgery perspective, I understand, having sat with hundreds of women in new patient consultations, I understand the changes that happen with pregnancy, with weight gain, with a myriad of changes that happen to women over time. People have very distinct concerns and questions. For me, I book those consultations at an hour. And frankly, I usually run over because there's so much to talk about it. And I don't meet with people when they're dressed down in a gown and kind of fighting to keep that gown closed. I meet with them dressed up, right? And I talk to them because I don't want to examine them first. I want to understand, what are your concerns? What troubles you? It's not breast related, but I think of Bob O'Neill, who was one of the faculty members at University of Michigan, and he tells this story about in the 70s. He walked into a room to see a pediatric consult, and the kid who was maybe 9 was facing away from him, and the kid's ears were like this. And Bob O'Neill, before the kid turned around, he said, "Don't worry, we can really help you with your ears." And the kid turned around and he held up his hand and he had 2 thumbs. He wasn't there for his ears. Mm-hmm. So the talking part matters, right? It doesn't matter what I see. It matters what you see. It matters what bothers you. And at the end of the day, my job is to help you to achieve your goals, not my goals. And so I want to know, first and foremost, that first 15 or 20 minutes is just talking. What bothers you? Where would you like to end up? And some people are super thoughtful about this process. They can describe where they want to be in words. Sometimes they'll describe it in pictures that they bring in from websites, the internet, whatever. That really gives me that visual. And for me in the aesthetic surgery realm, thinking about breasts or bodies, it's very, very helpful to have that visual about this is where you want to be. And at that point, we do the exam. And then there's the opportunity for me to say, hey, I know my skill set. I know what I do well. I know what an expected post-op result with me is. There's a break point in that consultation where either I say, I can absolutely get you where you want to be, or hey, either I'm not your person or your goals are not in line with what I can produce surgically. And there are a minority of patients that I don't offer surgery to. And that may be because I don't feel like I can get them where they want to be. It may be that they're not a great medical candidate because I'm always thinking about the safety of surgery part. But at the end of the day, I don't offer surgery to everyone that I meet with because I feel like my skills and your goals have to be aligned. And I need to believe that I'm going to get you where you want to be. If not, I'd rather bow out in the beginning. So that's why the conversation is so incredibly important.
Yeah. It's a people industry.
It is.
It's not just medicine.
It is a service industry, right? The patient gets to choose the terms of engagement. This is where I'd like to be. For me, it's about being honest and upfront, saying either I can get you there or no, I can't. From the breast reconstruction side, it is a very different paradigm. Women who are having cosmetic surgery and men who are having cosmetic surgery, they choose to see me, right? Breast cancer is very different. Many of those women would never have envisioned setting foot inside of a plastic surgery office. And many of them open that conversation with, I never thought I'd be sitting here, but. So breast cancer is very different. And unlike the cosmetic surgery population where we have the time to say, hey, we're going to think about your medical issues. We're going to get you medically optimized. We're going to do all these things. Sometimes in the breast cancer population, we don't get those choices, right? Sometimes people come in and they don't have the best nutrition because they've been in chemotherapy. They don't have the best social situation. And so it is a very different playing field to navigate to make sure that we can safely offer people an operation. But breast reconstruction is a completely different paradigm. It is, well, maybe it's not so completely different. I think for everyone that I'm working with, the goal is to understand where do you want to be. And for some people, that's an ideal that's in their head that they've never been. For the breast cancer population, often it's, I'd like to get back to where I started. So again, to understand those goals and figure out how to get them there. And for breast reconstruction, it comes with a myriad of different options. Tummy-based reconstruction, replacing the volume of the breast with the volume of the tummy using microvascular techniques. Very, very tiny blood vessel hookups on the order of 2 millimeters in size, done under a very powerful operating microscope, something that my partners and I uniquely excel at, and that is not me tooting our own horn, but we are the only group that offers that DIEP reconstruction. From here in Spokane, you'd have to go to Minneapolis, to Salt Lake, or to Seattle to find an equally experienced group. And it's a surgery that we're doing hundreds of times every year as a destination practice in this region. That is a unique operation because it repurposes tummy tissue to build breast, which is great, but also allows us to focus on abdominal aesthetics because the closure of the abdomen after that surgery is similar, not exactly the same, but similar to a tummy tuck, but absolutely matters. So again, a broad overview of the 2 things that I do most, which are aesthetic surgery and breast reconstruction, both with a notable focus on breast and body.
Okay, well, you own Plastic Surgery Northwest. You're a co-owner. What do you envision the legacy of this company to be?
It's a great question, and legacy is a great word and way to think about it. And frankly, my answer is very different now in 2026, even than it would have been when I started here 7 years ago. For the longest time, certainly when I was in training and in practice at University of Utah, my legacy was intended to be the patients that I had the chance to take care of. As I've taken care now of thousands of patients in my career, it is really interesting to run into people out in the world. And, I finish last visits here at Plastic Surgery Northwest and I say, hey, and maybe I'll see you at a Spokane Indians baseball game or on Lake Coeur d'Alene this summer. I ran into one of my patients in line at Disney World of all places. And she and I had this aha moment, oh, out of context, but here you are. So it is awesome to see people out in the world, right? I always expected that was going to be the legacy, that I would take care of thousands of patients and they would be happy and back to their day-to-day and frankly, leaving me in the rearview mirror. Private practice is different. And what I figured out about being in private practice and especially about owning what is now a medium-sized business is that the legacy of Plastic Surgery Northwest and as me, Chris Pannucci as a surgeon, will not only be the patients that I take care of, it will also be the mutually beneficial relationship of all of the employees and owners of Plastic Surgery Northwest. I realized at some point that this organization right now employs 70 people. The work that we are able to do, and I say we because it is not just me, it is absolutely a team with everyone from our billing staff to our medical assistants to our downstairs surgery team. The work that we are able to do provides a livelihood for 70 families in the community. Kids that go to college, mortgages that get paid, careers that get advanced, skills that get learned. I never realized that. But now that I am in the organization and now that we are hiring people and figuring out what services to offer and what skills to teach, you look around and, I've been here long enough that I've seen some people's kids, that were in junior high school and now they're graduating high school and they're in college or they're getting their first jobs or people saying, hey, I paid off my mortgage today, and all of a sudden that becomes the legacy, right? It's not only the patients that Plastic Surgery Northwest and me as a doctor am able to take care of, but it's also that we get the opportunity to support each other, the employees and the staff and me, and actually mutually lift each other up to achieve our collective life goals too. What a cool opportunity. One that I never envisioned, but one that I feel so grateful for as a practice owner.
So plastic surgery, I'm sure, is an ever-changing industry. How do you keep up with the new trends and the research, new procedures?
Most of what I learned in even residency is becoming irrelevant. That is so crazy for me, given that I spent 8 years learning it. The principles of surgery have not changed, but the procedures that we offer, the way that we're doing them, the integration of technology, the upswing in artificial intelligence, there are so many things that even 21 years ago, when I started in residency, we never would have thought of. It is implicit to my job to be up on what is new and upcoming and novel. And I will admit, I am not an early adopter. You will not see me on the front end of anything. But I am definitely that second wave of I am very, very grounded in the greater plastic surgery community through a previous job in academia, through ongoing research. You ask, how do you stay connected, right? I'm at the meetings. I'm usually teaching at the meetings, but also attending. And for me, that's the opportunity to see the latest and greatest. But for me, most importantly, is to talk with that wave of early adopters, to understand okay, you're the first 3 people to try this technique, to use this product, whatever it is. You've done it with 25 people. Tell me your experience. And there are things that I have rolled out in my own practice based on those people that I've known for 10, 15, 20 years, right? Based on their opinions, seeing their own pictures, understanding the journey of their patients, and me saying, you know what, I want to roll that out in Spokane. And, my mind automatically flips to 4 or 5 things, even in the last 2 years, that I have either talked with my colleagues about or learned about at meetings and then brought back to Spokane. I spend way more time than I ever could have conceptualized on social media. And, whenever I'm at a meeting, I'm usually taking a video saying, and my goal of being here, right? The meetings are often in nice places. I'll tell you what, I would not choose to go to a meeting in Hawaii if it means leaving my family behind. I'd much rather be with my family. But it is my obligation as a plastic surgeon to have lifelong learning as something that I do. And so I'm at the meetings, I'm shooting social media, and I will always say the same thing. I am here so that I can bring the best of the best back to my patients in Spokane. I am willing to take time away from my family to travel. Granted, if it's in Hawaii, it's not that big of a stretch. But to be out there, to sit through meetings, to pick out the subtleties and nuance, to grill the presenters about their actual experiences, and then to say, you know what? This solves a problem that I've been noodling with. This creates a solution for a patient that I can think of. I'm going to bring that back to Spokane. And so I'll work with physicians. I'll work with the industry. I'll try to bring new products in, because ultimately, how could I not? How could I not advocate for my patients? How could I not offer them the best of the best? Mm-hmm. So that's one reason to go to meetings. The other, quite honestly, is because I have a 20-plus year research arc. And so lots of people go to meetings to learn, as I do, but I also go to meetings to teach. And for me, in particular, I have spent 20 years researching patient safety in plastic surgery with a focus on blood clots like deep vein thrombosis and pulmonary embolus. I've been super fortunate to have funding from the federal government, from national organizations, from institutions, in order to push that patient safety issue forward. And with some of my research colleagues, have been very fortunate to publish the literature that practice is now based on. Every year, the American Board of Plastic Surgery sends us our annual exam, and it's a general knowledge exam that everyone takes. And it's pretty cool that most years in a question or in an exam that's 30 or 40 questions long, at least one or two of those questions is patient safety related and based on research. It's actually my cited research in the comments. So that's pretty cool. I talk about research as an influence multiplier a lot. And the idea with that is let's say I can operate on 3,000 patients in a career. Just this February, I was invited to be faculty at the Atlanta Breast Symposium, which is the national breast surgery meeting for both aesthetics and reconstruction. And I had the chance to present on not only patient safety, blood clot things, but also some new techniques and paradigms in breast lift and breast reduction. I actually just the other day on social media posted a scrolling shot from the podium. What did I see? And I look out and I see 120 surgeons in the audience taking notes. So when I think about that, it means that if I can positively impact the practice, if I can help 120 surgeons to do safer surgeries for the remainder of their careers and teach them something that they can take home and use on Monday, what that means is that the multiplier part is that now I have 120 surgeons whose care I've been able to help improve, and if they each go out and operate on 3,000 patients. So again, research is an influence multiplier. And maybe before social media that wasn't so clear, but now the idea of influencers is out there. Some of my research mentors were the original influencers, even though they don't like to be told that.
I love that. Well, you have a deep love for research.
Indeed, I do.
We can hear that. What would you say is your favorite part about it?
I think that research, we've talked about plastic surgery as a creative specialty, and I think research is no different. Somewhat ironically, I have spent the overwhelming majority of my research career focused on patient safety, and that is well known to the plastic surgery community. That is not what I am most well known for in the world. I am most well known in the world, research-wise, in the general population for a very subtle and nuanced research idea that breast implants can have unexpected protective effects. To back up, I was going to the OR with a thumb injury. I had a patient with a thumb injury, and it was like 2016, and it was like 2 a.m. at the University of Utah. And just as we were about to roll back, the OR desk called, and they say, "You got bumped." I said, "What bumped me at 2 a.m? They said, "It's a gunshot." I said, "Okay." It's a gunshot to the chest. The trauma team heard you're here. They want you to come down. I said, "Why?" They said, "I don't know. They just go down." So I go down. Wonderful patient, wonderful woman. She's fine. The trauma surgeons say she doesn't have an intrathoracic injury. Her heart's fine. Her lung's fine. We're not going to operate on her, but she's got a breast implant sticking out of her chest. Can you deal with that? All right. So it turns out this lady had a close range gunshot injury. And when we went to the operating room, she had an entry wound that came in straight on. She had an exit wound that came out at an angle in her armpit. And she had a ding off of one of her ribs, like an injury on the rib. So my fellow, Neil Moores, who's now in practice in Salt Lake, at 3 a.m, looked at me and he said, "Do you think the implant changed the bullet trajectory?" I said, "Neil, it's 3 a.m. Just be quiet." And so, but I thought about it for 3 days and I could not get it out of my head. My brother-in-law is a forensic engineer, or at the time was working as a forensic engineer, Adam Sear. And I called him. I said, "Adam, can a breast implant deflect a bullet?" And he said, "That's a crazy idea, but I'd sure like to help you find out." And I called my buddy Martin, and Martin used to be a sniper in the German military, but at the time he was a radiation physicist at the University of Utah. I said, "Martin, can you shoot a breast implant at a range of 8 feet repeatedly? He said, why? I said, never mind why, you're on the team. So we got one of the implant companies' mentor to fund this research. And I went to my boss at Utah, Jay Agarwal. I said, Jay, do you know the discretionary funds that you gave me when I started here? He said, yeah. I said, I'd like to buy 400 pounds of ballistics gel and ship it to the University of Utah. He gave me the green light. So the three of us, it's like a bad joke, right? A forensic engineer, a marksman, and a plastic surgeon show up at the range. Here we are, we had a minivan loaded with ballistics gel and breast implants. And of course, it was the day that the Boy Scouts were at the range. They had lots of questions. We had lots of very concerned parents with wide eyes in Utah wondering what we were doing. But the end of that research is that we did a very rigorous clinical study that clearly demonstrated the presence of a breast implant. When the bullet goes through a breast implant first, the penetration into the ballistics gel was decreased by 20%, plausibly supporting that the bullet's energy is reduced and it can actually be protective. Now, fortunately, not many people get shot in the chest, especially with breast implants, which is great. But we leverage this research to say, well, what about car accidents? And we actually got the company to fund another study, and my partner Chad Wheeler was part of this, where we took over the mechanical engineering school at the University of Washington, and we custom embedded breast implants into that medical grade ballistics gelatin and used one of their drop towers to simulate a low-speed car accident. And we actually showed that the presence of an implant diffused the force at a level which was plausibly protective against rib fractures and lung injury. So this, of course, went viral, as you can imagine, and somewhere on social media, it's got like 150,000 views and some pretty ridiculous comments, as you might expect. But it is the thing in research that I am better known for in the bigger community, which is that breast implants can have unexpected positive benefits and specifically can be protective against traumatic injury. Kind of fun.
So innovation is very important to you. How do you plan to take innovation and kind of run with it in this next year? Yeah,
I think innovation in plastic surgery is a given, right? It is something that is inherent to the way that we are trained, the way that we think. I remember a limb salvage case at the University of Utah where I knew that it was going to be hard. It was a gunshot injury to a lower leg, and I was doing a free flap, a microvascular transfer. And I had actually written down plans A through G because I knew it was going to be hard and I didn't want to have to think about it in that way. So I wrote it down, I stuck it up on the wall. And in the operating room, I ticked off A through G. None of those were going to work. And I had to innovate and make up H on the fly. And H worked. And we saved the guy's leg and he's back out there walking around. You know, I've talked about a lot of things, right? Where, you know, first kidney transplant in the world, the wound vac, microvascular surgery, so many things that plastic surgery has brought to the forefront as innovative. I don't know what's coming next. There's some really incredible stuff with AI, and that's more from a presentation of results perspective, but how AI can potentially change how we're doing surgery or how we think about surgery. I think about the role of microvascular surgery as one of the ultimate problem-solving concepts. How might it pair with technology better to pre-laminate, prefabricate, pre-construct defects? There are so many things, but at the end of the day, it really comes down to research. But it also comes down to a willingness to adopt those things into your own practice. And we talked earlier, why do I go to meetings, right? Why am I at a couple of meetings a year? Not only teaching, but also learning. And it is because I don't know what's coming next. I don't know what other people are working on. But once it's ready for prime time, I want to be one of the first to hear about it so that I can start thinking, would my patients benefit from that? Is that worth me going to learn? Can I help people here at Plastic Surgery Northwest better? Mm-hmm. Our specialty is innovative. Our specialty requires that you be willing and able to pivot and to learn new things and to try new things. And my practice reflects that. You know, the things that I did year one in practice are wholly different than the things that I'm doing now, year 13, almost 14. And I expect that, you know, in 13 or 14 more years, I'm going to be doing way different things now. Innovation is key. The ability to learn, to bring the best to your best, the best of the best to your patients is absolutely key.
Tell us how your future patients, current patients, anybody who wants to work with you as their plastic surgeon or has questions, how can they get in touch with you?
I'm easy to find. I am in the community. I spend lots of time out in the world, and I have had conversations with people at bars and restaurants, at Lloyd Coeur d'Alene in the summer, at a concert, at a Spokane Indians game. And, you know, some of those are educational, right? And for people that I meet in town, it's possible that I could be their doctor. And so I always just try to give them a high level understanding. I don't examine people in public, but, to understand this is what breast aesthetic surgery can be. This is what tummy aesthetic surgery can be. This is what breast reconstruction can do. And they're welcome to make an appointment with me if I meet them face to face. People can call the office. People can reach out on social media. I am easily findable. I am easily Googleable. I try to respond to emails and inquiries personally. And sometimes I'll even call people in advance of a consult just to make sure that I'm the right person for them and that I'm really dialed with their goals. I get calls from a bigger picture. I know lots of people across the country, and there are lots of people that have questions about surgery. And so I am always talking to friends of friends on the phone. And, I have a friend recently who lives in Texas, and she had a friend who had questions about surgery. And there's a million plastic surgeons in Texas. I know a lot of them. And she called me. And it wasn't that she was going to leave Texas to come up to Spokane and have surgery. She certainly would be welcome here. We do destination surgery, and we have paradigms to bring people in and have them stay for a period of time. But that wasn't a call to say, can you be my surgeon? It was, hey, you're a trusted friend of a friend. Can you give me an objective opinion about are my thoughts about aesthetic surgery in reality land? And I took that a step further, right? Not only to talk with her about, hey, everything that you're saying makes sense, being a mom of 3 who has concerns about her breast aesthetic. And by the way, here's some people that I know that I see once or twice a year at meetings who are in Texas. And if you're going to go see somebody, go see one of them. So there's a lot of ways that I end up having conversations about plastic surgery. And it comes back to that normalization component, right? Like my goal is that, and we talked about this earlier, is that the conversation around plastic surgery is normal, right? That it is not weird or unusual to talk about aesthetic ideals, to talk about breast aesthetics, body aesthetics, breast reconstruction in an open setting. I don't want to have a sidebar with somebody. I don't think I should have to. And I don't think that they should feel embarrassed about having those questions. So I'm always happy to talk. I'm always happy to have the conversation. Folks can reach out by calling the office, by requesting a consultation with me, or if we're running in the world, say hi. I'd love to meet you.
Perfect. Thank you, Dr. Pannucci.
Well, I appreciate the opportunity. Thanks very much.